you don't, this may be something you're compensating for, but as you're compensating, you're learning bad habits. And people just, no one's ever been kind of professionally trained how to talk unless you're a singer or things like that. The vocal cords look fine. Other things that we're looking obviously for masses, tumors, polyps, cysts, they look fine. We're looking for, if you're on Wixella, sometimes people can get thrush on their vocal cords. That's not the case for
like
you.
A
Everything
yeast
else looks
infection?
fine. Yeah, like a yeast infection, but that's not the case. So everything else looks good. So all I see is a kind of muscle tension. And actually, when you first started doing your exam with me, your voice sounded very clear, and I saw a lot less muscle tension. And then as we started using it a little more, then I saw more muscles, and then I heard it more kind of like how you were when you first came in. So I think you're having a functional muscle problem, and for that we have you see a speech therapist. Just sort of like an Olympic athlete needs coach. Even it may sound very rudimentary about getting a coach to talk, but it's just helping you use your voice more efficiently. Because over the long run, if you traumatize your voice more, you can cause nodules, you can cause like little irritated lesions to pop up. Okay.
So doctor, at this point, we don't know what's causing my voice to get this way?
I just told you, it's muscle tension.
Muscle tension.
Muscle tension. We have ruled out all the other sources, right? Your vocal cords are moving fine. There's no thrush. You don't have a nodule. You don't have a mass. Those are the things that we're concerned about. You also are surrounding it, not so much on your vocal cords, but just surrounding it. You do have some acid reflux stuff just in the area, and we've known you. That's why we have you on stuff like that, and so treating that. Now, in addition, I don't see a lot of it today, but if you do feel that postnasal drip, you do feel that kind of irritation, just get back on the saline rinses. I can even give you a refill of the budesonide so that you can have that, and you can tinker with it to kind of do how things are going. If things are going very well, then you can just do plain saline sometimes. If things are causing more issues, then you can do plain saline more, once or twice a day, or you can add the budesonide, because it seems like you got some benefit.
Yeah, since you said that, I will, in my mind, already settled that I am going to start back to the saline.
Yes.
If you want to prescribe the other one.
I will prescribe it, yes.
Okay, that'll be fine. Now.
And that way you can have it just sort of. I don't see a lot where you need it all the time.
That's for the post-nasal.
Yeah.
Yeah. As you remember, when the first time I saw you, that you did the same procedure you did now. It was more congested back then, remember?
Mm-hmm.
Yeah, it had a lot of phlegm there. Right?
Yeah.
And that was why.
That's why we did it.
And I was going to say to you, stress to you something. When I came to you that time, the stress of all this phlegm, mucus, nose to the throat, it was horrible. It was because of the coughing so much. It was causing me to have this main feeling, tiredness, almost fainting feeling at times. All of those symptoms were there. But I noticed that one day it was like poof, it just went away. Now I got up, I was feeling better. I was walking around better. I was in the kitchen doing my work better. Now without getting all that dismay, feeling drop dead almost, feeling like, daily. I used to have that. Now it's been much, much better. So I'm thinking that maybe you can testify to this, that maybe because of the reduction of the phlegm and maybe that's what used to cause that problem for me.
I mean, if you kind of see, that's why we were treating it. I couldn't tell you if it was the exact source, but that's why we give you a trial of what we think can help you based on what you've tried and what you haven't tried and what we see. And then that's why you have told me that you've gotten improvement since then.
Yeah, because when you prescribed what you prescribed, and I was using it as you prescribed it, it took a long time though. I don't know how long it took, but it took a long time. But when he hit me, I go, wow, I said, I'm feeling better. My body is now getting back somewhat normal.
Right.
A little bit, but I don't get as tired like I used to. It's gotten much, much better there.
And that's what we're happy for. That's why we see you.
Yeah. And then this voice now, see, this is not my voice. This is somebody else's voice right now.
Right.
What would you think is a good regimen for her? Or what is your regimen in the morning, Mom? With the nasal, you start with nasal rinse?
Yeah, I start with I'm not using the rinse anymore. But I'm gonna go back to it as soon as you say so. No,
for the last 2 weeks.
Okay, for the longest now, I don't remember how many months or a year, or more. I do after I brush my teeth, I do the nasal spray.
Okay.
And then I do it in the morning and I do it in the night.
Which one is that? Is it a prescribed one?
Yeah.
Yeah, it's an allergy nasal spray.
Yeah.
And then after that?
And then, I just start my day, with
Well, what time do you take your
eating, and then I
your
start
medication?
and I start taking my medications.
Which one?
Because some of them I have to eat. I have to take it with food.
Well, which one is it that you take?
Well, I take the cholesterol medication.
Every morning?
Yes, every day.
After the cholesterol medicine?
I take the very first one is the acid reflux medication. Not to look at.
You take that at night, don't you?
No, I take that in the morning before I eat. Half an hour before I eat.
Okay.
That's every morning. That was every morning. But now I gotta take it twice a day, so I take it also before I eat something somewhere in the afternoon or in the evening. So it's a dinner.
So after nasal spray is the Montelukast?
That's the acid reflux.
That's
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 what
the allergy pill at
that's
night.
the allergy pill. That's a bedtime.
okay.
That's the last one I take. I take all these others first, throughout the day. And then the Montelukast is the last one. That's it. I'm done for the day.
So no Wixella, no albuterol.
Oh, well, those, yeah. The Wixella, I take it twice a day. Morning and evening. But in between, I take the way he uses the word, the rescue medicine, which is albuterol.
And that's every day?
Yes, sometimes 1 time, 2, 3, 4 times a day. That's needed.
Where is the speech therapy at, or do they come to the house?
No, they're at Coastline. They're the next building over. They will call you to schedule that.
Yeah, okay.
Okay. So I'll have you give that to her.
Okay, so to give this to the
Give this to my nurse.
nurse?
Yeah.
Okay.
And then she'll print out a bunch of instructions and we can reinforce the things that we talked about. Okay?
Dr. Rowe, thank you so much.
No problem. Come
Yeah,
with me.
it's awesome.
Okay, so the next
Thank
time
you.
I'm gonna see you, I don't care how long I have to wait, it's gonna be in Figueroa, because
Oh, your choice, yeah.
I
I'm
don't
not
like,
always
I
there
don't like
though.
coming over here.
That's okay.
You're
That's
here
okay.
more often than there?
Yeah, like 90% here.
Oh, are you?
I'm
Oh,
like twice a month, maybe over there. 2 times, it's like 2 days a month.
yeah, well, I gotta wait for that appointment though, next time over
That's
there.
okay. Alright, come with me.
That's close to me.
Oh, that's